All righty, everyone. Welcome to the conference. I have the pleasure of introducing the Miller family, Debra, Paul, and Hawken, the founders of CureDuchenne and the hosts of this conference.
Oh, music. My spot. All right. Welcome. Wow, what a room. Look at this. Thank you for making the trip. Thanks for being here. I hope to talk to each and every one of you before this weekend's over.
Absolutely.
So truly, it's special that you're here. We appreciate you being here. Thank you for making the trip. Debra, Hawken, and Paul. We welcome you. We also, for those that aren't here, that couldn't make it, and you're online watching, welcome and enjoy the show. Thank you for being here online. This room, this weekend, couldn't happen if it wasn't for our sponsors, so let's thank the sponsors for being here. Also, make a point to meet them. They're going to have an opportunity to mingle, and so say hi and thanks directly to them when you see them. Our CureDuchenne team will be wearing the black t-shirt with the bilingual cure on the back of it. So if you have any needs, questions, there isn't a bad question, so please look for them for any assistance throughout the weekend. And also, that CureDuchenne team put this on, so thank you, CureDuchenne, the team. Fantastic. Just a couple key points to take note for the weekend. You don't want to miss our keynote speaker, Dr. Peter Marks, who will be coming up shortly. It's very cool that he's here. There's several sessions on research, best care recommendations, and all sorts of interactive conversation opportunities. I challenge you to go first, meet people, and make some new friends. The exhibitor showcase, meet the partners. Now, this is a tough deal for our kids. They're going to have to do this. I know they might be grudging a little bit, but there's the e-gaming. Please encourage them to go to the e-gaming. I heard it's a lot of fun. And also, this is a memorable experience this weekend, and make the memory. Go to the time capsule. You'll be happy you did when you capture the memory of this weekend, and help us capture the whole power of what we're doing here and coming together. So the time capsule, take advantage of that. CureDuchenne link. Help us help you by collecting the important data so that we can get better at what we do. And I am officially the CFO of CureDuchenne, the Chief Fun Officer. So that's what I'm going to make sure each and every, let's have a good time this weekend too. This is not something where we should still have joy in our lives, and with joy we get this thing cured. So have fun while you're here. I want to turn this over now to my beautiful bride and our CEO, our fearless leader, Debra Miller.
Thank you. Good morning, everyone. It is so good to see all of you here. Thank you for coming. It's just a pleasure. And I am also going to give a shout out to the biotech companies, pharmaceutical companies that sponsor this conference. Without them, it would not exist. And so another round of applause for all of our pharma biotech sponsors. So a little recap of yesterday. It was a good kickoff day. We had a lot of information early in the day, and I think a lot of fun in the evening. Yesterday, we had our second annual Meeting of the Minds here in the hotel. And we had all of the pharmaceutical and biotech companies that are developing drugs for Duchenne in one room to share information, to collaborate, and to figure out the best way to accelerate drugs getting to our guys with Duchenne. We had the distinct pleasure and honor of having two leaders from the FDA join us, Dr. Peter Stein from CDER, and Dr. Peter Marks from CBER, which you'll meet in just a few moments. It was a very useful meeting, and we will continue being the liaison between all of you, the families that need these drugs, and the drug developers that are making these drugs. And then we transitioned to the welcome reception last night, which was so wonderful to see people that we've known for years and new families. Families that have come from across the country and families that have come from across the world to be there. Brazil, Costa Rica, Spain, help me. Mexico. If I'm missing anybody, I'm sorry. But it's become truly an international conference, and I'm so glad to have you all here. Hawken was able to join Adults with Duchenne for the adult meetup. We had, on the other end, newly diagnosed families meeting. And please, if you are newly diagnosed, reach out to everybody in our staff here. And we have a bunch of resources to share with you and make your journey as positive as possible. So why are we all here? I know why we're here. This guy here, 22 years ago, little blonde hair, blue-eyed guy, we knew things were just not quite right. And as many of you have experienced, we had almost a 2-year ordeal and journey to try and get a diagnosis. Nobody knew what Duchenne was, including us. And when we heard that word and did the Google search, just like all of you, it was devastating, terrifying. We felt helpless. We didn't know what to do. The doctor told us there is no treatment, there is no cure. Go home and love your child. And unfortunately, we're still hearing that many families are getting that same bit of advice when their son is diagnosed. We found that to be totally unacceptable. And we were naive enough to think we could make a difference. And sometimes you just need to not know what's in front of you to take that first step. Because had we known 22 years later, we'd be standing here in front of all of you wonderful people, it would have been a little bit overwhelming. So early on, we had, no plan. But what we did have was faith and a determination that we're going to do everything we could to save our son. And then once we started meeting all of you, we fell in love with all your kids too, and made a commitment to try our best to do what we can to extend and improve the lives of every single individual living with Duchenne. But again, every day, it's our faith that gets us through, and we are so grateful for all of you and the opportunity that has brought us together. We have hope. We have hope in our future. We have hope in the science. We have hope in the medicine. But hope without action is futile. And so we all need to come together to put that action behind the hope so that together we will cure Duchenne. Science has accelerated so fast. My husband's a hockey player. I'll use the hockey analogy, and here I go. I mess them up all the time. But if you look at the research that we funded starting 20 years ago, the research projects were few and far between that were available for us to fund. And as we've moved through the years, that slope has increased and accelerated. And over the past few years, it's almost a straight up slope where we have funded so much research, and it's moving forward so quickly now that the rate of drug development has increased exponentially, and we're so proud of that. But we still have a long way to go. But let's just look at a year ago. What's happened since then, since we were all together in San Diego? CureDuchenne Link, our biobank repository and registry platform. We've finished 3 research projects with the data that all of you have contributed. And these are projects that are going to help accelerate research. These are samples and data that drug developers need to do their job really early on so that we can get these drugs to patients. We've all heard about Sarepta's good news this last year, and the approval for 4 and 5-year-olds with gene therapy. And we're anxiously awaiting to see what comes next for Sarepta and for all the other therapies that are coming through the office of the FDA. Italfarmaco got their drug approved. Vamorolone got approved. Dr. Castro's CureDuchenne clinic has grown to over 125 Duchenne and Becker patients. We have multiple exon skipping trials in progress, some of them in late-stage clinical trials. We have multiple gene therapy trials in progress, and we're going to be seeing results from these trials very, very shortly. CureDuchenne's commitment to you is threefold: cure, care, and community. CureDuchenne is known for its research. The companies that you're going to see presenting here today that are either early stage or even late stage or approved drugs, for the most part, CureDuchenne funded them very early, sometimes when they were just an idea. But that is our commitment to you, that we will not stop funding research. We've come so far, but we have so far to go until every single individual, no matter what your age is, young or an adult, has the treatment. Care. As we've shown with Dr. Castro, partnering with her with the CureDuchenne clinic, we know that we have to have transition plans. We have to be able to have care for guys as they transition into adulthood. And we couldn't be prouder of this relationship we have with Dr. Castro, but we need to do more, and we will. Community, you're part of it. And this community isn't just you, the families. It's the scientists, the physicians, the biotech and pharmaceutical companies, the regulators, the payers, all of us working together. And CureDuchenne stands in the middle there to be a facilitator, to make it happen, and I'm sorry, to be that mama bear that is going to drive this to happen. So let's embrace together, let's embrace tomorrow together, and together we will cure Duchenne. And now it is my pleasure, and I'm a little biased, but one of the most incredible human beings on the planet, our son, Hawken Miller.
Thank you so much. It's really good to be here with all of you. I had a great time yesterday at the kickoff party, participating in some wheelchair races, I think to the concern of some parents, but I think all limbs are accounted for, so that's good. And I want to encourage you, throughout this conference to think about your goals, to be realistic with your goals, and to not let Duchenne get in the way of the things that you're looking to accomplish, to focus on what you can do and not what you can't do. Also, like my dad said, I encourage you to meet new people, exchange contact information. I challenge you to try to meet 5 new people this conference and really learn from each other and have that community like my mom was talking about. This Duchenne journey is challenging, to say the least, but because of that, we have to rely on each other. And as they say, it does take a village, so I'm appreciative of every one of you here that is contributing to the health and well-being of everyone with Duchenne. And I also, for me and my family, have relied on my faith in God. And alongside that, we have an optional non-denominational prayer gathering Sunday morning at 8 a.m. at the Cordova 5 and 6 ballroom. So if you're interested, please come by there. And now, I am excited to...
Whoa, wrong.
All right, you didn't see that. Okay.
Unsee that.
So I'm excited to unveil our 2025 Futures Annual Conference
He's taking control now.
location. So a few fun facts about our Futures destination next year. So this city holds the Guinness World Record for the tallest cowboy boots in the world. You can see where this is going, at 35 feet tall. It's the most visited city in Texas. And this is really gonna make it easy for you. It's the home of the Alamo. So we are going to, can I get a drum roll? San Antonio, Texas. We're excited to hold Futures at the JW Marriott San Antonio Hill Country Resort and Spa on May 22nd through 25th, 2025. With a 9-acre water park and a 1,100-foot lazy river, this is going to be an amazing place for our conference. You won't want to miss it. Thank you so much, and we look forward to seeing you there.
All right. In addition to your chief fun officer this weekend and your part-time MC, I am also the custodial services consultant and a little housekeeping here. Probably very important for you all to know there's bathrooms here. They're on the outside either way, and so there they are. And directional signage is all over the place. I mentioned that the CureDuchenne staff in the dark black t-shirts with the bilingual Cure on the back are here to help. Signage, you should be well cared for with that. And for those of you that are using childcare, please have your phone turned on vibrate, just in case you maybe need to talk to them. And I've got this program here, Wi-Fi. It'll tell you in here how to get to the Wi-Fi if you haven't already. And don't forget to download the CVent app for this conference. It's very helpful. And finally, this just in, we have a pop-up, and God bless you for the grandparents that are here. We have a pop-up luncheon over here at lunch today. Don't miss it if you're a grandparent. It's very cool that you're supporting your family, so thank you.
Yes,
I think, and now?
that's it.
See you, honey.
See ya. And now it is my distinct pleasure to introduce our keynote speaker. Dr. Peter Marks has become a household name in the Duchenne community. Peter Marks is the director